Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. As many mothers keep worrying about not having sufficient breast milk and keep consulting doctors for the advice, so I have tried answering all your queries regarding breast milk sufficiency in this video. The following points will help in decision making. Does the baby pass plenty of pale color urine frequently? Is minimum of 6 to 8 times in 24 hours. Does the baby sleep after feeding for 1 to 1.5 hours without getting disturbed? Is your baby gaining weight? If your answer is yes for all the 3 questions, then your baby is getting enough milk, and so stop worrying. Remember, most newborns lose up to 10% of the weight initially and regain birth weight by 10 days. Thereafter, the weight gain is around 200 grams per week in the first 3 months, 150 grams per week in the next 3 months, and 100 grams per week in the next coming 6 months. And the other important factors to be considered are: remember, giving other feed before breastfeeding will decrease the vigor of sucking by the baby and will lead to incomplete emptying of breast and suppression of lactation. Another important factor to be considered is feeding bottles. These cause nipple confusion. So, what is nipple confusion? When a breastfed baby is given a bottle during the first few weeks while he is still learning how to breastfeed, nipple confusion can occur. A nipple confused baby may have difficulty latching or may try to use a bottle feeding type of suck on the breast. You can see the signs of nipple confusion here. So, sucking from the bottle is a totally different and at the same time a more easier job compared to breastfeeding. When both are offered, babies who generally tend to be lazy resort to more easier technique of bottle feeding. If baby requires top feed along with breast milk, it should be given only after breastfeeding both sides. Never ever give top feeds before breastfeeding. Top feed should be given only using steel paladai or steel cup and spoon. Never ever use a feeding bottle with artificial nipple. Watching the baby feeding is the next step in assessing the breast milk sufficiency. Wrong posturing and wrong techniques must be corrected. The baby should suck on the areola and not on the nipple. Make sure your baby is having good attachment for adequate breastfeeding. You can see the 4 signs of good attachment here. Breast engorgement, sore nipples, retracted nipples, etc. may need treatment, and do consult your pediatrician or a gynecologist. Reassurance and motivation to the mother is the best medicine for achieving breast milk sufficiency, and this medicine works better if it's coming from the family members. Hope I have answered most of your questions regarding breast milk sufficiency, and thanks for watching. If you have any further queries, please do ask in the comment section.